Hello my lovely friends, welcome to 24 Telemed, the Anambra State e-health services access care. Today I want to talk about a topic that is scary an average normal human being, but not to make it a big deal. We now have a lot of control over the disease and condition. The human immunodeficiency virus, HIV. Human immunodeficiency virus infection, HIV infection, is an infection that affects the immune system of the human body. The immune system of the human body is, if you like, say your soldiers or your army. The main target of the HIV virus infection is to target the cluster of differentiation cells, the one that we popularly call the CD4 cells. The HIV cells targets the CD4 cells and then weakens the immunity, the immune system, against opportunistic infections and chronic infections. So once the CD4 count of an individual falls below 200, then the person's immune system is highly compromised, and then the person is prone to infections and a lot of other small and sometimes chronic diseases. And once the person's immunity is compromised and is being predisposed to several infections and even chronic diseases, then the person can now be said to have acquired immunodeficiency syndrome, AIDS. AIDS is usually caused by two kinds of HIV. We have the human deficiency virus type 1, the HIV 1, and we have the human immunodeficiency virus type 2, the HIV 2. My lovely friends, the virulence and the transmissibility of the HIV type 1 is usually higher than the HIV type 2, but that does not mean that HIV type 2 is not in existence. It is in existence. It's just that the HIV type 1 is usually more virulent and more prevalent. Right now, I want to talk about the risk factors associated with HIV. Studies shows that the most primary, the most common, the most usual, the most risk factor of HIV is sexual intercourse. Sexual intercourse is the most common primary cause of HIV. There are other risk factors: vertical transmissions among women of childbearing age from mother to child, sharing of infected sharp objects such as needle, blood transfusion. Again, something else you need to know about HIV is that for now, because I'm praying that soonest there is going to be a complete cure for HIV, but for now it is still a control therapy. So there are antiretroviral therapy. There are antiretroviral therapy for control of HIV, but it is something that you'll be complying with every day. Every day you need to be taking your medications every day, like the doctor prescribed. It's not you need for a lot of diseases, especially people in Nigeria. They'll ask you to take your malaria medicine every 12 hours, and then you decide to be taking it sometimes every 8 hours or every 15 hours. With HIV, you need to be 100% and absolutely complying with your medication. If you are supposed to be taking it by 8 a.m. in the morning or by 8 p.m. in the morning, you should not be skipping it. If your drug is still remaining 5 to finish, go and get some medications. Talk to your doctors about the effects, about how you feel, about a lot of things. There are numbers of doctors that are going to be answerable to you and willing to respond to you, help you manage your situation, manage your medications and all. Just go to the description box of this video, visit our website, visit us on all social media. Just go to the description box, you'll see our social media handles, you see our website handle, and you see the numbers of the project managers. These doctors are here and willing to respond to you every time and any day. And then I'm going to ask you a quick question. Let me assume that Mr. P, right, has HIV, and then his babe also have HIV. Are they supposed to be without protection, or should they just enjoy themselves and without protection? To be honest, this is a question that one of my lecturers asked us when we were in pharmacy school, and most of us said they should without protection. Unfortunately, it is not like that, right? Why is it not like that? Because there are two kinds of HIV, like I had explained initially on this video. There is HIV type 1 and there is HIV type 2. HIV type 1 is more virulence and more prevalent than HIV type 2. Doesn't mean that HIV type 2 is not in existence. You need to contain what you already have. She needs to contain and protect what she already have. And then you should always have protected sex every time and anytime. That is part of why you need to be talking with your access care doctors. Don't do it alone. Don't carry the burden alone. Allow professionals, allow healthcare professionals to help you and to manage your condition with you. Alright, so this is going to be where this video is going to be ended. I have to leave for Mars. I'll see you in my next video. Bye!